Why do they have it, and is it necessary to have that right after surgery?
Yeah, it's a very frequent question.
Yeah, let's breathe. And then 3 seconds, right?
And after the DrHE removal, the patients say generally, "Oh, it was that?
Yeah,
it
that
wasn't
was
that
it."
bad." Yeah, it's not painful.
Yep, it's here, all about health. So I'm Lily, and I am a coordinator, of course, as you may know, at DrHE Obesity Clinic. And today we have another special guest to talk about health eventually, and we have gathered many questions that most of you guys have, most of our patients eventually, about bariatric surgery, what to do, what's not to do, what's going on, basically everything. And today we have our amazing and basically one of the best, our surgeon, Dr. Saeed.
Thanks a lot, Lily.
Welcome, Dr. Saeed.
Hi, thanks.
How you doing?
Fine, and you?
I'm good too, I'm good too. Thank you. So today, it's very simple. Our patients and many other people have questions about bariatric surgery. And we have, we've taken few questions, most of the questions that our patients have eventually, so that you can be here as the surgeon to answer them and basically give all the information. Okay, so let's start. So, Dr. Saeed, first let's start with that. What's bariatric surgery?
Bariatric surgeries consist of restriction procedures and malabsorptive procedures. Some procedures have only restrictive part. For example, gastric sleeve, only reducing the stomach volume, so it means this is a restrictive surgery. But some procedures like bypasses consist of restrictive surgeries plus malabsorptive surgeries. So we reduce the stomach volume, and also plus we make a connection between stomach and intestines. It means we have a bypassed intestines. So there is a malabsorptive part. These are the bariatric surgeries generally. Two parts, restrictive and malabsorptive surgeries.
Perfect. Thank you very much. So let's start. When does a patient reach his or her ideal weight after a bariatric surgery?
It really depends on what the patient does. We always underline the condition to this. This is not a magical surgery. This is just a useful tool to use. We really recommend the patients over BMI 40, but reaching the aim is changing. Most of the patients have their ideal weights on the 6 months to 1 year. But usually the ideal weight is reached in the first year.
Okay, perfect, lovely. And so what would you say is a bariatric surgery success? Like what's the success, like the percentage?
The real question is, what is the success?
Yeah.
What does success mean? If we accept the success is losing the weight, losing the excess weight over 50%, in our database, our success is 90%. But if we accept the success is reaching the BMI of 25 to 30, the success rate in our database is nearly 80%. So the real matter is, what is the success? What does success means? But roughly 90% of the patients are pleased to have the surgery. This is a big possibility. This is a real chance. 90% of the patients are pleased and happy to have the surgery. But 10% to 20% are regaining the weight, maybe not losing the weight, and they're not pleased to surgery. We always open to our patients with this risk of the bariatric surgeries. 10 to 20% are not pleased and unhappy after the surgery because of the unsuccessful losing weight.
Okay. So let's say a patient has done his or her bariatric surgery. So would you say after the bariatric surgery, there will be scars on the body left on?
Generally, we have 5 scars after the surgeries. This is laparoscopic surgery. It means it's not open surgery like that. It's laparoscopic surgery. It means we will do the surgery with trocars. There is 5 small incisions after the surgery, and on the right side, the biggest incision is 1.5 centimeter, and we will take out the stomach on the right side side incision. So the biggest one is 1.5 centimeter. The other trocar is camera trocar, is on the center and 1 centimeter, and the others are 5 millimeter. Totally 5 trocars, 5 small incisions, and the biggest one is 1.5 centimeter. After the surgery, generally we don't have any healing problems. But in obese patients, there are some problems. This is called healing problems and hypertrophic scars. It means bad healing. In obese patients, there is so much inflammatory conditions in the body. So it means there is a healing problem. So it causes hypertrophic scars under 1% of the patients. But it's not a big problem. It's not directly related to sleeve gastrectomy or bypass. Whatever he or she have, the surgery, maybe appendectomy or gallbladder surgery or the other surgeries, the patient will have the problem of hypertrophic scar if he or she has the problem of healing.
Okay. Perfect. So usually when we see the patients, at our clinic that have a bariatric surgery, we usually see them after a few hours with something like here, right?
Yeah.
So, and it's called
It's
drain.
called drain, yeah.
Yeah. So why do they have it, and is it necessary to have that right after surgery?
Yeah, it's a very frequent question.
Yeah.
Really wondered question. Actually, there is no obligation for the drain. Actually, most of the surgeons have abandoned to use the drain after the surgery, but we really love using drain because right after the surgery, if there is a risk of bleeding, we can see the drain. And if there is so much blood in the drain, we have some measures. We have early measures like stopping the blood thinners and giving some anti-blood thinner medication. So we really follow the drain just after the surgery, and we have some early measurements after surgery. The other surgeons can follow the vital signs only, but we like always following the vital signs with together the drain. Especially on the second day after the surgery, we are giving blue dye for leakage test. This is a leakage test. The patient swallows the blue water, so we are following the drain. If there is a blue water in the drain, this is physics. The patient swallows the blue water, it goes under the esophagus and the stomach. So if there's a leakage, we can see the blue water in the drain. It means there's a leakage. So the drain is useful when following the leakage. So leakage and bleeding is followed by the drain. After the second day, we will take out the drain. This is the most frequent question. Is it painful? The drain removal is painful.
Because definitely. Is it?
But the question is, this is not a pain. Actually, this is an uncomfortness feeling for 3 seconds, just for 3 seconds.
Okay. Let's breathe. And then 3 seconds, right? Okay, and then it is
this
removed.
is a weird feeling, just weird and uncomfortable feeling for 3 seconds. And after the drain removal, the patients say generally, oh, it was that?
Yeah,
it wasn't that bad. Yeah, it's not painful.
Have you ever experienced any patient crying, grabbing you please no, remove it, something like that?
Very rare.
Okay.
Maybe the anxiety patients.
Yeah.
The patients have anxiety sometimes. It's always a related condition, anxiety disorders. Yeah, under 1% we have this feeling.
Yeah.
Some crying patients, but always the anxiety patients cry always before the operation, after the operation.
Yeah.
We cannot stop this crying because it's related to anxiety.
Yeah.
But I must say it's not painful.
Yeah. So we definitely got it. It's not painful. So then another question that we usually have, or we receive mostly for you, is after a bariatric surgery, a patient has to go back to his or her normal life, routine life, work, if it's a mother or anything,
maybe.
Sport and things like that. So after it, can they go back straight to work? For instance.
Yeah. If there is no complication, if there is no problem on the second day or the third day, the patient will be discharged to the hotel. 80% of our total patients want to go to hotel on the second day.
Yeah.
This is a very big percentage. 80% wants to go to hotel on the second day. And the the 20% wants to stay for one night, extra one night, it's not a big problem for us. And on the third day, he or she will be at the hotel.
Yeah.
And one day before the flight, we have a last check for the incision control and examination right before the flight. And if there is no problem, they are allowed to go to their own country. So after a week, they are on their own countries.
Yeah.
And if they want, they can go back to their works
Yeah.
and their normal life.
Yeah.
After a week, everything is normal. The pain will be decreased. The nausea feeling will be decreased. But if there is a possibility to rest, maybe extra 1 week is better. And after one more extra week, they can do everything.
Everything.
They can do sports. Let's talk about sports, by the way. They can do sports until a month.
Yeah.
They can do basic sport exercises like stretching exercises. I mean, like yoga and Pilates, like little bit fast walking, you know, like jogging maybe, but no over 10 kg lifting.
Okay.
But over a month, you can do everything.
Okay.
Over 10 kg lifting, sports, and yoga, Pilates, fast
Swimming.
walking, swimming,
Yeah.
fast running. Just after a month, you can do everything. So give yourself a month, to do everything.
Everything.
Yeah.
Perfect.